the health and welfare plan. I've been a trustee, or was a trustee, on the health and welfare plan from the time I was elected president in 1998 up until 2005 when I became business manager. When I became business manager, I felt, and I've always felt, even prior to that, that it's important to have as many people involved in local union, the functions of the local union as possible. So at that point I took myself off as a trustee and allowed other people to step in. I go to all the meetings, certainly have say-so and influence on our policy, but when it comes down to voting, I don't have an official vote. Over time, our plan has run into some troubles. Many of you remember about 8 or 9 years ago, we had a problem where our members were using the plan more than the money was going into it. We had some very sick members, and more money was going out than was coming in at a rapid rate. What we did is we made a correction at the time, took $2 an hour from our members' annuity plan and put it into the health and welfare plan as a stopgap measure. We committed to our members that we would do this for 8 months, and that's what we did. In 8 months, we put the money back in the annuity. We received a contractual raise at that time, and then we made the changes to the contribution rate that we needed to take the plan into the future. Some other plan improvements that we've made over time. In the year 2000, we hired TIC to, after an extensive search of third-party administrators, we hired TIC to become our third-party administrator. Prior to that, we had a small company in Indianapolis doing that, and what brought on the change was the year 2000, the Y2K issue. Many of you may remember that there was a lot of concern about computer systems and how they would handle the rollover from 1999 to the year 2000. The current administrator was not prepared to purchase the new computer systems that were necessary, so it required a change, and that's where TIC came on board. It was about 2004 that we hired Blue Cross Blue Shield of Michigan. Up until then, we had a local PPO that was sponsored by Memorial Hospital, which meant that we used the Memorial Medical System, but we could not use the St. Joe Hospital in their system of doctors and clinics. It was a problem for our members, so we reached out, did some searching and did some interviewing, and hired Blue Cross Blue Shield of Michigan. What that ended up meaning is our members can now go anywhere in the United States, and just about 95 to 98% of the doctors, hospitals, pharmacies, the clinics that our members might go to across the country, they get out their Blue Cross Blue Shield of Michigan card, and it will be accepted at that facility. This was very important to us, not only locally, where we could use the St. Joe and the Memorial systems, but now our people going out of town, our members out of town, our retirees that live outside of the area can have access to a large number of hospitals and facilities. Excuse me. A couple of other items that I think our members use a lot are our mail order prescription plan that we put into place probably about 4 years ago. It's very convenient. I use it myself. I can go online. I have an account at Merck Medco. You set that up. You go online. You can, with a couple of clicks, you can reorder your prescriptions in a few days. They're at your mailbox. The best thing about that is you can get 3 months of prescriptions for 2 months of copay. It's convenient for the members, and it's a cost savings for the plan, and many of our members take advantage of it. Another big item our members seem to enjoy, and again I know I do as well, is the supplemental benefit account. The SBA can be used for any medical item that is not covered by the plan. That includes co-pays, deductibles, eye care, dental care, and you can even pay your plan premiums with your SBA account. And in these times of extended unemployment, SBA plans are being used heavily for just that. Today, the plan is in the $6 million to $7 million range, and we are poised and in good shape to take our members into the future and cover their health and welfare needs. We're always looking for opportunity to make things easier for our members and less expensive. And when those opportunities come along, we take advantage of them, and if they make sense for our members in retirement.